Hi, welcome back. We hope that you are doing pretty well. I'm Dr. Patti.
I'm Dr. Angela.
And today we're going to talk about hormonal acne, a rather sensitive topic and something that brings up a lot of emotions. And, it's acne on our face most of the time, and it can be a little bit traumatizing. We're going to talk about some of the triggers and some great treatments that can be very helpful. And I've personally experienced very severe acne, pustular whiteheads, like really just all over my lower face. So I can definitely empathize with how challenging it is and how difficult it can be in terms of the experience.
Yeah, I'm actually really excited we're doing this video because I too have struggled with a lot of acne in my life. And I'm almost 41 and I still get acne. But this is a great topic to be talking about because it's actually pretty easy to treat hormonal acne. And I feel like, most of the ways we handle it in conventional medicine is, take birth control pills or just kind of like shut down the cycle. And there are so many really easy natural medicine ways to address the hormone issues that lead to hormonal acne. So excited that you're here tuning in with us. So there's a few different ways we can get imbalanced in terms of our hormones that leads to outbreaks. And so looking at things like estrogen dominance, so that means that the amount of estrogen relative to, say, progesterone tends to be higher. Another really common one, I think this is the one we think about most often, is coming from androgen excess, so having high testosterone or high DHEA. And then we don't think about this one as much, but high cortisol, so high stress, which so many of us are stressed all the time, that can also lead to acne. So we're going to talk about some of our favorite ways to address each of these hormone imbalances and help you have great skin.
So detoxing the liver and helping the gut in terms of detoxing overall is a really great place to start in terms of getting rid of those excess hormones and the excess byproducts of those hormones.
Always. I think, like in naturopathic medicine, we're always talking about how everything's about the gut. And truly, there's just so much when we treat the gut.
Yeah,
it helps everything in skin.
So speaking of the gut, one very easy or simple, I shouldn't necessarily say easy, thing that we can implement is lowering or avoiding our sugar intake and also reducing or avoiding temporarily or permanently, if you're up for it, our dairy intake, cow's dairy especially. So that can definitely affect our gut health and can affect our hormones as well. And we'll go into that a little bit more in a minute. But in terms of detoxing the liver and helping the liver to metabolize those excess hormones, I love some herbs actually to support that. And that includes dandelion. The weeds that grow outside on the sidewalk are actually a really amazing herb for the liver. So drinking it as a tea, taking it in food, eating it in salads, a wonderful herb. Burdock is another great one. I also love milk thistle. That's a very common one that a lot of people have heard of. And this other category of herbs that contain berberines. Berberine is the active constituent, but herbs like Goldenseal and Oregon grape, these herbs also contain berberine and really help with the liver as well. And anything in the thistle family, so not only milk thistle, but artichokes as well.
Delicious. You can eat them.
Yeah. So anytime you can eat your medicine, that's really helpful.
Exactly. Like I love to eat the dandelions as well. So all of that. Yeah. And also in terms of the detox, we can do some amino acids that can be really helpful as well. Taurine and methionine can be taken individually or as part of, detox formulas really help. NAC, glutathione, those are really great ones for detox pathways, which will really help balance out hormone levels.
That's really helpful. I tend to use a little bit more herbal medicine, so I'm learning a lot from Dr. Angela in terms of the amino acids and what helps the body with hormones. So
we learn together with you guys. It's really great.
Yeah, completely. So if estrogen dominance is the picture that you're experiencing or sort of what's going on with your hormonal imbalance, a couple of things that you can try are eating cruciferous vegetables. So going back to food and nutrition and food as medicine, but cruciferous vegetables include Brussels sprouts, broccoli, cauliflower, and a nutrient called DIM, which comes from broccoli.
Yeah, you'd have to eat like pounds of broccoli to get the therapeutic dose levels. And so eating as many cruciferous vegetables as you can, but then also supplementing with, a couple hundred milligrams of DIM is a great way to help with clearing some of that excess estrogen. And also a big one, back to the food, is fiber. Fiber really helps clear excess estrogen levels. It helps you just, every time you get the bowels moving, you just clear excess hormones that have built up. So it's a really easy one to do. It's like gentle detox every night.
Yeah, and you can just grind up some organic raw flax seeds or take some chia seeds or psyllium husk. I don't know why, but in my brain, I just think of this fiber like soaking up like a little sponge, the excess hormones and hormone metabolites that we don't want, and just flushing it out of our gut. So it's a great, easy, budget-friendly way to really help with hormone metabolism and detoxifying the gut.
Yeah, so true. So the flip side of estrogen dominance may be that you could possibly not be ovulating regularly. And if that's happening, then your progesterone is going to be really low. So you might not even have high estrogen, but your progesterone could just be so low relative. And so one of the ways that we ensure that we ovulate regularly is to take herbs that help with that. And so Vitex is a great herb that helps with regular ovulation. It's also called chasteberry. And then I really like myo-inositol quite a bit too, and that really helps with regular ovulation. It's a really good one.
And keep in mind also stress management is really important in terms of how our cortisol and stress levels affect our progesterone. And
yes.
Watch Dr. Angela's video on inositol because she talks about how much it helps with anxiety and stress. And it also helps with your progesterone balance and ovulation. So it's a really helpful video. Yeah,
there's a couple ways there. You know, it's like the myo-inositol will actually keep down the cortisol levels, but then also if we are stressed all the time, then we can, we divert those pathways. So maybe we're using some progesterone to make cortisol. So just different ways that these things kind of loop into one another and can be really helpful.
And then speaking of inositol, there's something else called Dchiro inositol. So if you actually do have high testosterone, which is very common sometimes, and it's sort of where I find with my patients who come in with acne, they've gone to a dermatologist, and a dermatologist may just sort of jump to treating as if somebody has high testosterone. But as we just discussed, sometimes your hormonal acne isn't just from or isn't due to high testosterone at all. But if you do have this picture, a great, again, maybe not the easiest, but very simple way to start bringing that testosterone down is to quit, avoid, or reduce your sugar intake and refined carbohydrates and processed foods and what turns into sugar in our bodies. So, and as I mentioned, Dchiro inositol, so a little bit different from the myo-inositol, can also help to bring down that testosterone.
Yep, and DHEA. And so we'll put doses and brands and things like that in the description box for you guys as usual. But yeah, both super helpful.
Absolutely. And then as far as treatment, yes, treating the cause is important and working on the hormonal balance, but 2 vitamins are very helpful for actually actively treating whatever acne or breakouts you may be experiencing. And those are vitamin B5, pantothenic acid, and what's the other one? Vitamin A. So vitamin A and B5 both help to balance that sebum production in our skin and our pores. So that can really help a little bit more immediately with treating that acne.
Yeah, clearing it up really quickly while we're getting to the root cause of why you're breaking out so that you don't keep breaking out. So just kind of working on both ends at once.
And a lot of synthetic drugs that treat, or synthetic pharmaceuticals that treat acne are actually based in vitamin A. So
it's true, Accutane.
So you can take vitamin A in a little bit higher dose than you would normally, but you wouldn't want to take it long term.
Yeah, vitamin A does store. It's a fat soluble vitamin,
which means it'll stay in the body, so it can become toxic.
Yes.
So you don't want to. It's not something that you would want to do long term at all.
So we'll talk to you about dosing that can be very therapeutic for acne, but again, we want to be really mindful of this is not a long term thing. I'll write that out for you as well. And you might even want to be supervised by one of your doctors if you're going to be doing higher dose vitamin A, just kind of checking in on liver enzymes.
Definitely. And then in the sort of same vein, the opposite of what can be helpful, we've noticed that biotin is very popular in a lot of hair, skin, and nail formulas. And biotin and B12, which is actually very helpful for stress, can exacerbate acne for some people. So keep that in mind. And so if you're taking a lot of biotin or taking a lot of B12 and you're noticing that your acne is flaring up, it can be exacerbating that. So you might want to cut down and see how that goes.
Yeah, do a trial of cutting down or just taking it out short term and just watching what your skin does. So we hope that this has been super helpful for you. Share what your successes have been, whatever you've tried with the community here. Leave us your comments and feedback, and we'll see you back here soon. Like and share.
Yes, and stay tuned, a little preview of coming attractions. We're going to do another video on skin health and what to do in terms of scarring and hyperpigmentation and just healing the skin after and even during your treatment of acne. So keep an eye out for that.
Thanks. We'll see you guys back here soon.